you give more weightage to what? Your college life or your school life in your personality development? And who is your favorite teacher in your school and college, and why he or she is your favorite? What your friends tell about you?
It has been a 1 week which has changed me very drastically. I was very afraid of it, that if I would be able to crack it or not. And after meeting you since first day, you gave me that positive attitude that yes, you will crack it no matter what, and we'll help you with it, and you'll crack it. So that's why it helped me a lot, and I'm literally very thankful to you. And I've seen a drastic change, be it medical portion, be it body language, be it any personal question, professional questions. I'm very confident enough, and I don't fumble much now. And I just straight away give the answer, and straight away things come to my mind because you've helped me prepare a lot. Thank
No
you, sir.
fumbling now, one thing. Not at all, single,
Yeah.
not at all. And really
Yes.
nice way of speaking its style and
Yes.
everything. Chaliye, Mr. Arjit, first of all, you tell me something about heat stroke.
Heat stroke. So, yes, sir. So basically, heat stroke is due to when we are exposed to too much sunlight, or when we are working in any field areas. So too much exposure to sun leads to dehydration, and sometimes the dehydration even may lead to heat stroke. Though, so the patient has loss of body fluids from the body, and the patient may go in a state of shock as well. So the patient needs immediate resuscitation. For that, we can provide him, depending upon the situation, we can immediately provide him fluids, if as long as the place provides. And we can give him oral fluids if the patient is able to. If the patient is unconscious or not able to take oral fluids, we can take him to a nearby health center and give him IV fluids, and uh, give him the necessary treatment whatever is required.
Okay, my next question is also very new for you. Bruise management, BRUISE.
Bruise management, yes, sir. So, bruise is basically loss. There is a breach in the epidermis and the dermis. So, any blunt abrasion or any blunt trauma causes a bruise, which may be further lead to any abrasion, or further deepen to may lead to laceration. So, for its management, basically, immediately we need to wash it with running tap water, and depending upon if it's a mild bruise, then we can apply a normal bandage over it. If it's a deep wound which has bleeding, then we can either go for suturing if it's a deep wound and there's too much bleeding. And if there's not much bleeding, then it can be managed via a simple bandage.
Okay, my next question is pyrexia of unknown origin. Its definition as well as management.
Yes, sir. So, basically pyrexia of unknown origin is any fever lasting for more than 3 to 5 days without lead any underlying cause, and with the blood picture and the various tests not leading to any certain cause, we can classify it under the category of pyrexia of unknown origin. With the fever more than and equal to the normal body temperature, that is 37.5 degrees Celsius plus minus 2 degrees Celsius. So beyond that, we'll consider it as pyrexia of unknown origin. So depending upon the patient's condition, we'll go for the various tests. We'll rule out various causes. We can go for the complete blood picture along with the various liver function, kidney function tests. Then we can, along with that, do various other tests to rule out like the malarial fever, typhoid fever, dengue fever. For that, we can do the rapid antigen kit testing to rule out any other causes. And if still we don't have any cause, then we can further give symptomatic treatment underlying the symptoms of the patient until and unless we find a cause of the pyrexia.
Okay. C spine
Yes,
injury.
sir. Sorry, sir.
C spine injury.
Cervical spine injury. Okay, sir. So basically, most of the road traffic and accidents and trauma patients, there is always a chance of cervical spine injury. So depending upon that, the ATLS guideline, basically the Advanced Trauma Life Support, says we have to first of all we have to manage the patient in ABC category, that is the airway, breathing, and circulation. in airway, we have to stabilize the cervical spine of the patient. Otherwise, if we are not stabilizing the cervical spine, we may damage the underlying cervical nerves or spines, the spinal cord, and it may further lead to diffuse axonal injury, or the patient may even die. So our main aim is to stabilize the cervical spine, and we have been given a special method to move the patient with a cervical spine injury, that is the log roll method. In that, four people are required. One stabilizes the neck, two people move the body to one side and put us one person puts a stretcher beneath, and via log roll method we can move the patient with a cervical spine injury.
Tell about your school and college life.
Yes, sir. So basically, I'm from Weinberg Allen School, Missouri, and I have done my entire schooling from class 1 to class 12 from Weinberg Allen School. And our school is basically, sir, it was built in 1888. That is more than 130 to 40 years old. It is one of the oldest school of our country. It's an co-educational school, and we were basically inculcated the lifestyle of disciplinary lifestyle since our earlier days in school. We were had to follow a timetable, a regular routine since a morning to evening. Along with that, we were inculcated the habit of daily games and activities. We had compulsory games every day. So earlier we didn't like it, but now we had new known the importance of that in present times, that every day we should have that physical activity. Along with that, our school not only focused on the academics part, but also focused on the co-curricular aspect as well. Like the we had to we every we Wednesday we had various activities like the debates, quizzes, and various other events. On Saturdays we had a special for our personal recreation. We had club activities that helped us in grooming for our overall performance. Apart from that, my family, sir, my family, there are five people in my family. My grandmother is the head of my family. My father is a shopkeeper. My mother is a homemaker. I have a younger sibling. He's an engineer, and he's currently helping my dad with his work. Thank you, sir.
Tell me about COVID discharge protocols.
Yes, sir. So, COVID discharge protocols, basically, sir, when a patient from a infection like SARS, that is COVID, recovers, first of all, we need to check upon the entire profile of the patient, that the patient isn't in the prodromal or the recovery phase, because if he's in the recovery phase, still he'll be a spreader. So we need to take care about that. So before discharging, we need to check upon all his viral markers, that the patient is not in the spreading phase. Apart from that, when the patient has no fever for around 3 to 5 days, apart from that, the patient is not a spreader. His viral markers are within normal limits. His blood picture is within normal limits. There is no rise in the WBCs or the platelet or all the viral markers. Then we can prepare him for discharge. And apart from that, we need to give him all the precautionary cares, and we need to advise him what all measures he need to follow at home, and all the sanitary measures that he should take, because still he is immunocompromised, so he can catch the infection again. So we need to advise him and then discharge the patient.
Secondary prevention of TB, tuberculosis.
Yes, sir. Secondary prevention of TB. Basically, sir, primary the difference between primary prevention and secondary prevention is that primary prevention we can prevent by giving medicines directly to the patient, and secondary prevention is we have to stop the other causes that is causing infection to from a patient to the other people, from like a tuberculosis patient. So a tuberculosis patient can spread infection via air, that is via sneezing, and via his blood fluids. So we need to take a measure about all these things before all these things regarding any tuberculosis patient in our neighborings or surrounding. If any patient is diagnosed with tuberculosis, we need to wear a mask with that person. We don't need to reuse that mask. We need to change that mask if uh, we're using a disposable mask. We need to maintain aseptic and we need to make sanitation protocols regarding that patient, regarding their linens, beddings, towels, so that there is not spreading infection from that tuberculosis patient. And we need to keep our immune system as well up to date, so because the we are also liable, if any immunocompromised patient is there in the family, he is also liable to catch the infection very early from that patient.
Management of cholelithiasis.
Yes, sir. So basically, cholelithiasis is any if any patient basically it's the development of gallstones in any patient. So, development of gallstones in the gallbladder. So, for its management, basically, we have two protocols. If a patient comes to us with acute pain, and if then we have to manage the patient by immediately taking their blood picture, their investigations, their ultrasound, and then we have to take him immediately for emergency cholecystectomy. But if a patient is not, if he's diagnosed on a routine regular checkup, then we can plan. First of all, we'll give him 20 to 21 days medication. Then we can plan him for interval cholecystectomy. And along with that, after that, we have to keep the patient on further medications for further gastroesophageal reflux and other side effects caused due to the removal of the gallbladder in such patients. And we have to keep them on PPIs, proton pump inhibitors, for excessive acid secretions as well.
Okay. My next question is COPD.
Yes, sir. So COPD, basically, COPD is chronic obstructive pulmonary disease. Mostly, sir, it's a disease of the smokers. In most of the chronic smokers, this is a restrictive type of lung disease in which the chronic smokers we develop the COPD, and it can be further classified into chronic bronchitis and emphysema. And so there is due to chronic smoking, the patient has emphysematous changes, which leads to dilatation of the alveoli. And this further has then we can further divide these are also called as the pink puffers and the blue bloaters, depending upon the clinical appearance of the patient. Then, similarly, we have the management of such COPD patients, like the emphysema patients. Basically keep them on the. Sorry, first of all, the clinical features. Clinical features, basically, these patients have early morning cough. They have a lot of cough with expectoration. we sorry we call them katar as well, that early morning katar. They have a very excessive early morning cough, and they have too much problem in the winter season due to the cold. Along with that, the patient has pursed lips, and he has a tripod position. He uses his accessory muscles of respiration for breathing, and has a slightly bent posture, and has a sinuous look, and hence we call them as blue bloaters. Along with that, the bronchitis patient, they are called the pink puffers because they have a pink flushing kind of appearance. Hence, we call them as pink puffers. For the management, basically, we keep the patient on. We have to start them on bronchodilators. From starting, we can start them on short-acting beta-2 agonists, that is salbutamol. Along with that, we can add them in long-acting muscarinic antagonist, depending upon the category which patient lies in. Depending on mild, moderate, and severe, mild patient, we can start them on short-acting beta-2 agonist. Mild patient, we can act short-acting beta-2 agonist along with long-acting muscarinic antagonist. And in severe category, short-acting beta-2 agonist, long-acting muscarinic antagonist plus inhaled corticosteroids.
Yesterday, I asked one doctor, like,
Yes, sir.
suppose there's one army man, one civilian, both has
Yes, sir.
got injured. Who will you treat first? So he answered me,
Yes,
sir,
sir.
army man.
Yes, sir.
So we discussed one word on that, one topic which you usually study in your MBBS.
Yes, sir.
What is that?
Sir, sir,
Whom will you
Hippocratic
treat?
oath.
पर्सनली अगर मैं पूछूं आपसे कि एक आर्मी मैन है, एक
Yes,
सिविलियन है, किसको जल्दी ट्रीट करोगे?
Sir, we can't choose upon this. We have to basically on triad system. We'll take
Very
this.
good. This
The
only I
patient.
want to listen from you. Now I want you to tell me the colorings of trias.
Yes, sir. So basically, the triad system is divided into five colors. We have red, yellow, green, blue, and black. So
Okay, wait.
depending
If I give you chance to place orange somewhere, then where you will place it?
orange, sir. So we need to first understand what kind of patients lie in the
No,
category.
no, orange, it's somewhat, there is a particular sign of that. Like if
Okay.
I tell you, see,
Yes, sir.
I have written something for you.
Yes, sir.
See, red is for emergency.
Yes, sir.
Then the word orange comes. It is very urgent. And then comes the
Okay.
yellow, which means urgent, and green is safe. Blue is very
Yes, sir.
safe, and black
Very
is
safe.
dead.
Right.
And suppose there is a war going on, then we
Yes,
are
sir.
saying it becomes opposite. Many people don't know this
Opposite,
also.
sir.
It becomes opposite.
Yes, sir.
So what are the colors that
Opposite.
time?
Colors, sir. Red will become opposite field color code, and blue. Blue will become red, and red will become
I
blue.
agree with you,
That
but
way.
what will be the coloring from the very first?
So coloring will be same.
Coloring will not be the same because the green will be more come early. As we know, it is
Okay.
opposite. So green, yellow, red, then black.
So, one
In
second.
war, green,
Okay, sir.
yellow, red, then black. In war. Okay.
Yes, sir. Okay, sir.
Okay. Now my next question. Uh, what do you mean by SGLT2 drugs?
Yes, sir. So basically, SGLT2, it's a sodium glucose transporter inhibitor drugs. Basically, these are a new class of drugs developed for treating hyperglycemia.
Okay.
Basically, these drugs, these are the channels present in the kidney, and these secrete out the excessive glucose from the. They stop the they absorb the glucose from the filtrate which is getting secreted from the body. So basically, if we use the drugs that inhibit these channels, they'll secrete out the excessive glucose from the body. So hence, it's a very good class of drugs. With the main side effect of these class that they are very prone to cause urinary tract infection, because the bacteria which grow in the urinary tract, they get a glucose upon which they can feed. Hence, there is very chances of growth. Hence, we have to recommend and tell the patient to maintain a lot of hygiene while using these drugs. And for classifying these drugs, mainly the drugs which come in these categories are the glyphosines, empagliflozin, and rafagliflozins, and all those drugs come in this category.
Explain about infertility.
Yes, sir. So basically, infertility, whenever we have any couple who's come up in a gynae clinic for family counseling for conceiving. First of all, we see the duration which the couple has come. If a couple comes to us within 6 months, then we recommend the patient to give the try, and we don't give any methods before that, and we don't give any trial for infertility before the duration of 1 year. If any couple comes to us after 1 year, then we look for the underlying cause, if there is any cause of infertility, and if the couple is not able to conceive. So then we go for a protocol in which we go for testing in both the males and as the female counterpart. In males, we go for the semen analysis. We check for the sperm count, the sperm motility, and in it, the main factor which we take into account is the sperm motility. With it should be more than 4 to 5%. In females, which we check for the female, if the female is uterus is compatible, and we check if there is not any adhesions, and we can go for transvaginal sonography ultrasound. Along with that, we can go for the follicular study for if the patient is having any proper growth regarding the follicles and or not, and then we can plan the protocol further according to whatever the patient comes to us and if any problems we have it. In today's time we have various techniques developed in which if any of the partner is not able to conceive, we can help them via various techniques like in vitro fertilization, and in IVF and IVU, that is in vitro insemination, IVI, and various other techniques we can help the patient to have a biologically parent.
Okay. Lung
Yes,
abscess.
sir. Yes, sir. Lung abscess. So, if any patient comes to us with complaints of difficulty in breathing and he has complaints of chest pain while expiration or inhalation, and if or she has any swelling in the chest wall, and if he has any changes in the voice, any on auscultation, if there's any sounds, we first of all we go for a chest x-ray. If there is any on investigation, if we find any lesion, or if we find any hypoechoic or hyperechoic lesion on the chest x-ray, then we can consider that the patient has any lung abscess. Then upon blood picture also we can check if it's if the blood count, that is the WBCs, are raised, then it can be empyema. That is basically the pus is there in the abscess. So for its management, basically we have intercostal drainage tube along with IV antibiotics depending upon the severity. If the patient is not severe, we can put him on oral antibiotics like amoxicillin and piperacillin tazobactam. And along with that we insert a intercostal chest drainage tube in the fifth intercostal space in the triangle of safety, and we look for the drainage from the lung abscess, and we monitor the patient, and whenever and when we remove, if there is and we monitor the patient unless the fluid is less than 100 cc for more than 24 hours. Then we remove the chest drainage tube, and then we can put him on only oral antibiotic treatment, and then we can send the patient back home.
Speak on
Yes,
heart failure.
heart failure. Sir, so heart failure basically,
Due to many reasons.
so we can say about MI in this.
You can
Sorry, sir.
myocardial infarction, or there are many reasons of heart failure.
Yes, sir. So basically, heart failure. It's the cause of heart failure is basically when the uh, cardiac muscles do not get proper blood supply, or there's hypoxia to the cardiac muscles, or any underlying cause which leads to decreased blood supply or decreased oxygen supplies to the heart muscles can lead to heart failure. So depending upon the underlying cause, we can further divide it into a myocardial infarction and angina. So depending upon the that, we have to see the clinical symptoms what the patient presents us with. Mostly patients presents us with chest pain radiating to the neck and the jaw, and radiating to the left arm, and difficulty in breathing along with that, and gastroesophageal reflux, so and heartburn. So when the patient comes to us, we go immediately go for a 12 limb ECG and provide him with oxygen. Upon taking a 12 limb ECG, we check for the rhythms what we are getting. If we get any ST elevation, then we can consider a patient is going towards an ST elevation myocardial infarction. Or if there is any prior ST elevation or prior P wave changes, then we can consider there was a previously old MI which the latent stages has is causing problems to the patient. Apart from that, if we are not having any ST elevation, then we can go for the troponin levels, which tells about the heart muscles. The Along with that, we can go for the LDH, lactate dehydrogenase levels. That if these levels are raised, then it indicates towards a non-ST elevation MI, and then we can plan our treatment according to that. For the treatment, we'll initially give the patient with for relieving pain morphine, We give them oxygen and keep the saturation above 90 to 95%. We give them nitrates, aspirin, to have vasodilation, and the cardiac muscles don't act, and they get proper blood supply. Apart from that, we immediately go for thrombolysis if there is any clot formation due to atherosclerosis. So we can give them antiplatelets and anti thrombolytic drugs like alteplase. The dose is roughly around 325 to 500 mg OD. And along with that, we can give them thromboxane A2 for the thrombolytics. And then we can go for angiography, because it takes a bit, it's a time consuming process, it's not a immediate process. So we take further, we stabilize the patient, and then we can go for angiography and find out the underlying cause. If there is any decreased blood supply or any thrombosed vessel, then we can go for any percutaneous intervention like stent replacement, etc.
Wonderful. Like
Yes,
most people are having gastric pain. So how will you
yes,
differentiate
sir.
that the pain is gastric, not related to heart? How you differentiate?
Yes, sir. So basically, one of the most leading problems in our country is gastric pain. So to differentiate between a cardiac cause and a GI cause, we first of all, if a patient comes in an acute condition, we give him symptomatic management, symptomatic relief. For the management, first of all, we can go for a H. pylori test. H. pylori test basically will rule out gastritis, that it if it's due to a particular gastric cause or not. If it's a positive, then we can particularly say that it's a H. pylori infection and gastritis is causing the cause, GI cause. If we are not getting H. pylori positive and still the patient is having, then we can go for further tests. Like we can ask the patient for various history, like orthostatic hypotension. That if the patient is having dizziness while getting up from bed, and patient has difficulty in breathing while sleeping at night, and along with that, if the patient is having any facial puffiness or limb edema, then we can further go for, along with that, we can go for any cardiac cause causing gastric pain or gastritis. Then, along with that, we can go for ultrasound. We can to rule out if there is any cardiac cause as well. Along with that, we'll give them symptomatic management for symptomatic relief, which also further somewhat denotes that if the patient is getting relief from gastric cause like proton pump inhibitors, that there is severe acid secretions, there is somewhat GI cause relating to the gastritis.
Okay, you told in terms of medical, how in layman language we can differentiate? Like this is a gastric pain and this is related to heart. This is not a AMC question. I'm asking
Yes, sir.
for the knowledge. Like how will you differentiate
Yes, sir.
at home that yes, this is the right time to give omeprazole or pantoprazole or
Yes, sir.
anything,
Yes, sir.
or this is the
Yes,
right
sir.
time to give Dispirin or
Yes,
somewhat
sir.
that is related to.
Aspirin.
Yes, yes.
Yes, sir. So
So
basically, yes, I can say that if there is any cardiac cause and if patient is having a heartburn, so the heartburn always radiates to the neck and the jaw and goes towards the left arm. But not in case of gastritis, patient only has heartburn. The patient does not have any arm pain or radiating towards the jaw. So one is this thing we can differentiate that. Apart from that, if the patient is having extra symptoms, then it goes somewhat towards the cardiac cause.
okay. Okay, tell me what is murmurs?
Murmurs, yes, sir. So basically, uh, any cardiac pathology upon auscultation, any cardiac pathology causing uh, abnormal sounds in the heart are referred to as murmurs. We have various types of murmurs in various types of pathologies in the heart, like in aortic regurgitation and mitral valve regurgitation, aortic stenosis, and tricuspid valve stenosis. All these cases, we have different types of uh, murmurs. And depending upon the various causes, we have to find them.
What your
Yes, sir.
friends tell about you?
Sure, sir. So basically, my friends tell that, say, I am a versatile person, and because I'm very adjustable in any places, and I am a team spirited person and a
Okay.
jovial person. So according to them I can adjust and in any places and interact them, and I'm very interactive and make friends easily.
And who is your favorite teacher in your school and college, and why he or she is your favorite?
Yeah, sure, sir. So basically in my school my favorite teacher was my sports teacher.
Okay.
Mostly it's not that, but our sports teacher usually they motivated us a lot, and they used to help us with our during our exam days. They motivated us a lot that we have a lot of stress during our exam days. One thing which I remember was that he always used to say that during your exam days you're just sitting and studying, so you have a lot of calorie buildup in your body, so there are a lot of chances of having injuries, fractures, getting into fights with your groups. So whenever you are just exhausted and whenever you don't feel like studying, just come, go down in the field, play for 1 hour, and all your stress and all your calories will be burnt, and you'll really feel happy. And you'll just stay away from getting injuries and getting into fight with people.
Right.
So that is one of the most important things which has stayed with me since that time, and I'm regular with physical activities and sports till today, sir.
Okay. And
Yes, sir.
you give more weightage to what? Your college life or your school life in your personality development?
So basically, both have an individual role
Agree with
because
you.
during my
But
yes, sir.
among that, which one you give more weightage? Where you get more chance
So
to develop yourself?
So I'll say my college life because during my school life, I was not that much mature enough to take up, and I was taught a lot of things, and I was taught, but I was not mature enough to grasp those things. That the things that came by reflex to me, I grasped those things. But during my college life, I was mature enough to learn everything which my teachers taught me, which I could learn from my professors during my clinics, and wherever I could encash whatever I would getting knowledge and etc. Sir.
From the very first day to seventh day, I really appreciate your changes in your personality. How you felt
Thank you,
about
sir.
PD classes? कैसा लगा आपको हमारे साथ?
So it has been a like a 1 week which has changed me very drastically. I was very afraid of it that if I would be able to crack it or not. And after meeting you since first day, you gave me that positive attitude that yes, you will crack it no matter what, and we'll
Yes.
help you
No.
with it, and you'll crack
Fair.
it. So that's way, so it helped me a lot, and I'm literally very thankful to you. And I've seen a drastic change, it be it medical portion, be it body language, be it any personal question, professional questions. I'm very confident enough, and I don't fumble much now. And I just straight away give the answer, and straight away things come to my mind because you've helped me prepare a lot very well. Thank you,
No
sir.
fumbling now, one thing. Not at all, single.
Yes, sir.
Not at all. And really
Yes, sir.
nice way of speaking and style and
Yes,
everything.
sir.
Great. Now you can
Yes, sir.
teach others. If you start
Yes, sir.
SSC, AMC and all this coaching, you can teach. No problem. You know all my tricks and
No,
you
sir,
know all
that
my
was just a,
strategies, how I teach and the way and everything. Now you can
no,
open
sir,
and
that I'll leave to that I'll leave to you only, sir. That you helped me. That you are very great at.
thank you. Really, it was a nice session with you. And later
Yes, sir.
on
Me too,
also,
sir.
as interview will start, I'll be helping
Yes,
you
sir.
out. I'll try to send you certain things to prepare. But if you find anywhere, anytime, my help,
Yes, sir.
do call me or write me. If you write,
Yes,
the
sir.
answer will be early. Because whenever I'll
Yes, sir.
get free, I will call you personally and give you the answer. So
Definitely,
if any
definitely.
question which arises and you think sir इसका आंसर मुझे मजा नहीं आ रहा, अच्छा नहीं लगा सर, इतना थोड़ा चेंज करते हैं
जी
अपने,
सर.
या आपको कोई भी
जी
लगे,
सर.
but you can.
जी
Okay.
सर.